Next section, cystic disease. Wow, look at that kid. Why, that looks cystic. That kidney looks awful cystic. Well, what causes cystic? Well, when you have a problem and you figure it can't be anything you did, who do you blame your problems on? My parents. That's what we have parents for, to blame our problems on. It's genetic, it's not my fault, it must be genetic. What causes it? I don't know, it's idiopathic. You know, polycystic kidney disease, you see this presentation? Flank pain, hematuria, infections, and calculi? Cystic disease presents very similar to infections and kidney stones. And the reason that cystic disease presents similar to infections and kidney stones is that the abnormal anatomy, let's look at that anatomy again. See that anatomy? That abnormal anatomy makes you predisposed to infections and stones and infections, and infections and stones and infections. Those cysts make you predisposed to stones and infections, infections and stones, infections and stones and infection. Now, the most common cause of death in cystic disease, the most common cause of death in cystic disease is not aneurysm. You waste away. You waste away with chronic and recurrent kidney stones and chronic and recurrent infections, and it puts you in dialysis, end-stage renal disease. In other words, aneurysms are not the most common cause of death. You see this? Only 10 or 20% have aneurysms. What is the most common site of cysts outside of the kidney? The liver. But look at the whole body is sort of loose and floppy. My kidneys are loose and floppy and cystic. My heart valve is loose and floppy and cystic. I got mitral valve prolapse. My diverticuli are loose and floppy and cystic. I got diverticuli. My liver, my kidney, my ovaries, my brain, aneurysms. But the most common cause of death is not aneurysm. The most common cause of death is chronic infection. I lose 2% of kidney function. A stone, I lost another 2% of kidney function. 8 months later, I got another infection, another 2% of kidney function. After 25 things, there's half the kidney gone. But the most common site is liver. Do I offer routine screening angiograms? No. Routine angiograms, not necessary. Now, you diagnose the cystic disease with spiral CTs and sonograms. However, what is the therapy that reverses cystic disease? Nothing. Nothing. What are we supposed to do? It's cystic. You have a stone, we manage the stone. You have an infection, we manage the infection. When you get end-stage renal disease, we try and get transplanted. But you know what? Cysts often recur in the transplanted kidney. Oh, that sucks. Now, polycystic disease, very bad. Polycystic disease, you end up on dialysis. Simple cysts, not a big deal. Simple, single cysts, as long as the wall is smooth, as long as there's no debris in the center, no garbage in the center, don't do anything. Now look at this here. It says very common, 60-75% of all renal masses. Right, but they don't do anything. If there's smooth walls and no garbage, don't do anything. If there's irregular walls or there's garbage and debris on the inside, then you aspirate them to see if there's cancer. Smooth walls, no debris, leave it alone. Irregular walls with debris, aspirate, aspirate. Irregular walls with debris, aspirate, aspirate. Smooth walls, do nothing. Irregular walls, aspirate. That's the end of cystic disease. It has a very small number of questions. Polycystic kidney disease. Yeah, sonogram CT, they want to ask you. What causes it? It's genetic. How do you die? End-stage renal disease. Should you screen for aneurysms? No. Those are the two basic questions. Simple cysts, you can be expected to know. Smooth and no debris, do nothing. Unsmooth, lots of debris, aspirate.